Erich Fromm received his Ph.D. at the University of Heidelberg in 1922 and had intimate contact with the historical developments of the psychoanalytic movement as well as the emerging social science of this period. He has extended Sigmund Freud's classic contributions to psychology and psychiatry by adding an intriguing social, historical, and cultural perspective to them. In addition to being the author of some notable contributions to the understanding of human personality, such as Escape from Freedom, Man for Himself, The Forgotten Language, and The Art of Loving, he is actively engaged in the training of psychoanalysts. He is a professor at the University of Mexico, the director of the Psychoanalytic Institute in Mexico City, and is a fellow on the staff of the New York University William Allison White Institute for Psychoanalysis. Dr. Fromm's unique contributions are not only technically significant to the professional in psychology and psychiatry, but have been of great interest to many in the other behavioral sciences as well as the humanities. His work has also been of profound interest to thoughtful members of the general reading public throughout the world. Part of the year he lives in Cuernavaca, Mexico. It was indeed a pleasure to be able to conduct this interview in his study in his home in Cuernavaca, where he engages in a great deal of his writing. Dr. Fromm, one thing that seems to many of us to be somewhat neglected is your current views in the matter of psychological treatment, psychotherapy. I was sort of wondering to what degree you view some of the therapeutic procedures that were developed by Freud and how you may agree or disagree with them, how perhaps you've expanded on some of those. For example, a very fundamental and central construct in psychoanalytic theory, of course, is the transference phenomenon, where presumably we're hoping that the psychoanalyst begins to become kind of a symbol of a father or a parent figure, and that there can, in a sense, the patient is transferring his feelings and emotions to an accepting, tolerant, neutral father or parent figure, and that they can then proceed to analyze the emotions and relationships that might give them some cues to the relationships that the patient had with his own father. Or this is a classic,
yes,
at least simple distinction
yes,
of this.
Yes.
Now, how do you view this transference relationship? Does this still seem to hold up as a fundamental factor in therapy as you see it?
Yes, I think actually Freud made a very fundamental discovery again in his concept of transference, and I would look at it a little bit more broadly, assuming that this is not specifically a phenomenon which you see only in psychoanalysis, in the psychoanalytic situation, but that it is a phenomenon which you find in the relatedness of a person, let us say of a neurotic person or unrealistic person, who partly lives in a world of his own fantasies in relationship to many other people. There's transference to a teacher, to a wife, to a friend, to a public figure, just as much as there is to a psychoanalyst. What I would say, I would define transference psychoanalysis, the irrational relatedness to another person which can be analyzed in the analytic procedure, while transference in other situations is one which is just the same, depending on the rationality of the person, but it is not open to analysis. It's not on the table of operation.
In other words, you can see this same concept being a valuable one in interpreting behavior in society at large.
Clearly. Let us say if somebody is impressed by power, somebody wants to be protected by a powerful person, he will have the same worship and the same overestimation of his analyst as he has of his professor, or he has of a governmental figure, or as he has of his minister or priest or God knows what. It's always the same mechanism. Only in analysis, this particular kind of irrational relatedness, which corresponds to a need of his, is brought to analysis. Don't forget, at least I say to myself, I shouldn't forget to mention, it is not a simple repetition, but what we are dealing with is a need in a person to have another person who fulfills this need. For instance, if I feel weak, uncertain, afraid of risks, afraid of decisions, I may want to find a person who is certain, who is strong, who is powerful, in whom I can take refuge. Naturally, I seek that all my life. This will be the kind of boss I seek for, or professor, if I'm a student. And this is what I shall see in the analyst. On the other hand, I'm a very narcissistic person who thinks everybody else is an idiot, provided he criticizes me. I will think that the analyst is an idiot, my teacher is an idiot, my boss is an idiot, everybody else is. These are all the same phenomena of transference, except in analysis we call it transference when we can analyze it.
You accept the transference phenomenon. You find it very vital in your own psychotherapy. However, there are those that almost from the beginning have been very critical of transference and have stated that there's a danger inherent here, that you may be creating dependency from which the patient cannot break away from. Now, obviously, in your own experience as a therapist, this is a problem that you are somewhat confronted with also. How do you feel about this? Do you think that this is a valid criticism of intensifying transference, that there's a danger inherent in here?
Now, I find indeed, wherever I teach, that there is great danger in the transference situation. But this has something to do with a number of issues. I think it is a mistake to believe that all that goes on between the analyst and the patient is transference. This is only one aspect of the relationship. But the more fundamental aspect is there's a reality of two people talking together, which in the day of the telephone and radio is maybe not such a, is not taken as a very serious reality, but to me it's one of the most serious realities. One person talks to another. They don't talk about trivial things, they talk about something very important, namely the life of this person. These people meet really on two separate levels. One, that of transference, that is to say, the person, or counter-transference. In the first place, well, let us put it this way, the analyst also has all sorts of irrational attitudes toward the patient. He's afraid of the patient, he wants to be praised by the patient, he wants to be loved by the patient. It's too bad. Shouldn't be that way. He should, by his own analysis, achieve the position where he doesn't need all that, but then this is really not always the case. But quite aside from this, there are also two real persons involved. And the patient, who is not psychotic, has a sense of what the other person is, and the analyst has a sense of what the patient is, and that's not all transference. And I think one very important fact of analytic technique is that the analyst must constantly, so to speak, travel on two tracks. He must offer himself as an object of transference and analyze, but he must offer himself also as a real person and respond as a real person.
Now, this is a very interesting point, because it seems to me that at this point here you are departing from certainly the orthodox Freudian view of psychotherapy and psychoanalysis, because in a sense, wouldn't it be correct to assume that Freud was involved in trying to create an illusion and intensify an illusion, and you aren't too concerned about that?
No, I'm really, in this respect, have a different experience from that of Freud, and actually I have both experiences because I've been trained at an Orthodox Freudian Institute in Berlin, have practiced as an Orthodox Freudian analyst for about 10 years, until I became more and more dissatisfied with what I experienced. I noticed, the most important thing perhaps was, I noticed I became bored during the hour. Perhaps the main thing to say is this here. Freud saw the whole analytic situation as a laboratory situation. Here was a patient who is an object. The analyst, as a laboratory man, watches what comes out of the mouth of this object. Then he draws all sorts of conclusions, gives back to the patient whatever he sees.
Now, this is a very interesting point. Now, we have, of course, as you know, in the United States, a very interesting theorist in the field of therapy who's done a lot of theory himself, Carl Rogers, who talked a great deal about client-centered therapy, yes, or non-directive therapy. And there's a very interesting question here of mirroring, becoming in a sense a mirror for the patient as against reinterpreting.
I am on the opposite side of Dr. Rogers in this respect.
All right, I'm glad you brought this out.
I think the whole expression client-centered therapy is kind of strange, because every therapy has to be client-centered. If the analyst is such a narcissist that he cannot center around the client, he shouldn't do the job he's doing. But I don't think client-centered therapy, which is something self-evident, means just mirroring. On the contrary, what do? I listen to the patient, and I see, well, I tell the patient, let me put it this way, look here, what we're doing is the following. You tell me whatever comes to your mind. That will not always be easy. Sometimes you will want not to tell me. All I ask you is, in that case, to say there's something I won't tell you, because I don't want to put any moral pressure on you that you have to do things. Probably in your life you have been told much too often that you have to do something. All right, but I would appreciate if you tell me that you're leaving out something. It rarely happens, incidentally. Mm-hmm. Then I say, all right, so I listen to you. And while I'm listening, I have responses, which are the responses of a trained instrument. I just am trained in this. So what you tell me makes me hear certain things. And I tell you what I hear, which is quite different from what you are telling me, or intended to tell me. And then you tell me how you respond to my response. And in this way, we communicate. I respond to you, you respond to my response, and we'll see where we are going. But I'm very active in this.
There is a very fine point of distinction here, and I think Freud was rather convinced that interpretations handed to a patient would perhaps give an intellectual insight, but it wouldn't give a real feeling, a real emotional insight. Now, when you talk here about this interchange, this communication, you're not necessarily, in a sense, giving interpretations to the patient, are you?
No. In fact, I don't even use the word interpretation. Right. I say what I hear. Let us say the patient will tell me that he is afraid of me. And he will tell me a particular situation. And what I hear is that he is terribly envious. Let us say he is all sadistic, exploitative character, and he would really like to take everything I have. Now, if I have occasion to see this from a dream, from a gesture, from free association, then I tell him, now look here, I gather from this, that, and the other that really you're afraid of me because you don't want me to know that you want to eat me up. I try to call his attention to something he's not aware of. Now, the whole point is here that there are some analysts, Rogers most extremely so, some Freudian analysts less extremely so, who believe the patient should find it himself. But I think that prolongs the process tremendously. It's long enough anyway, and difficult enough anyway, because what happens? There are certain things in the patient which he represses, and he represses it for good reasons he doesn't want to be aware of. He's afraid of being aware of it. If I sit there and wait for hours and months and years perhaps, until these resistances are broken through, I waste time for the patient.
So you're really saying that subtle directiveness can cut down the time of the therapeutic process?
Yes, I'm not even directive. I'm doing the same which Freud does in dream interpretation.
I see.
The dream is a harmless dream, maybe. And yet what Freud says is, this dream really says, you want to kill me. Well, I do that with other things too. I'm not directive. I tell the patient what I see, and then I analyze the patient's resistance to what I'm saying. Or if there's not much resistance, then the patient will feel it. But I'm very aware of the fact that intellectualization doesn't help a bit. Mm-hmm. In fact, makes everything impossible. What matters is whether the patient can feel what I'm referring to. I start out here what you might call a humanistic premise. Namely, there is nothing human which is alien to us. Everything is in me. I am a little child, I am a grown-up, I am a murderer, and I am a saint. And there's not, I'm narcissistic and I'm destructive. There's nothing in the patient which I do not have in me, and only inasmuch as I can muster within myself those experiences which the patient is telling me about, either explicitly or implicitly, only if they arouse an echo within myself can I know what the patient is talking about, and can I give him back what he's really talking about. And then something very strange happens. The patients will not have the feeling I'm talking about him, nor that I talk down to him, but the patients will feel that I'm talking about something which we both share. May I
yes.
quote a sentence from the Bible, from the Old Testament. The Old Testament says, love the stranger, because you have been strangers in Egypt, and therefore you know the soul of the stranger. One knows another person only inasmuch as one has experienced the same. And to be analyzed oneself means nothing else but to be open to the totality of human experience, which is good and bad, which is everything. I heard a sentence from Dr. Buber recently about Eichmann, that he could not have any particular sympathy with him, although he was against the trial, because he found nothing of Eichmann in him. Now that I find an impossible statement. I find the Eichmann in myself. I find everything in myself. I find also the saint in myself, if you please. Analysis really means, if I am analyzed, that means really not that I have discovered some childhood traumata, this, that, and the other, primarily. It means that I have made myself open, that there is a constant openness to all the irrationality within myself, and therefore I can understand my patient.
So you're looking for respondent chords in a sense then?
Yes, and I don't have to look for them. They are there.
They're there.
Therefore, my patient analyzes me all the time. The best analysis I ever had is as an analyst and not as a patient. Because inasmuch as I try to respond to the patient and to understand, to feel what goes on in this man, I have to look into myself and to mobilize those very irrational, archaic things which the patient is talking about. If the patient is frightened and I repress my own fright, I will never understand the patient. If the patient is a receptive character and I cannot mobilize that in me which is receptive or was receptive but which is still there, at least in the small doses, I will never understand him.
We have a kind of an interesting schism today developing in the whole area of psychotherapy, as you well know. Those who would like to use this ultra-historical approach that the orthodox psychoanalytic group has used, where you go back and in a sense the patient has to live through or relive step by step every pattern of development. And then we can have an opposite view where we look at the present situation of the patient and try to deal with the realities around him at that moment as the source of his problem and using only incidentally these historical patterns. Now, would you say that you are moving more toward the situational orientation or the historical or perhaps somewhere in between?
No, I think it's a wrong dichotomy.
All right.
I would say this. What is our aim? Our aim is to arrive at an insight into the unconscious processes which the patient has right now. Psychoanalysis is not historical research per se. We want to know, we want to take an X-ray of what goes on in the patient unconsciously now, that is to say behind his own back. That's our aim. All right. Now very often, however, the patient himself will understand this only if he can experience some, re-experience some childhood experiences, because they will really give flavor or specificity to something right now which he's not aware of. Sometimes that happens in transference, sometimes it happens by remembering something which he experienced as a child or even which he experienced as an adolescent. We are full of these experiences. Sometimes they come up in dreams. It's nothing that in a dream something comes up, a material which has happened 30 years ago when the patient was 17. But my aim is not historical research. My aim is the clearest awareness of that which is unconscious now, but in order to reach that aim, very often, maybe most of the time, it is necessary to see what the patient experienced when he was a child, when he was an adolescent. Actually, when I'm analyzing myself, which I do every day, I try quite intentionally to feel what I felt about this, that, or the other when I was 5, when I was 15. I try to see what of this feeling is in me. I try to constantly keep open my own connection with my childhood, to leave it alive, because it helps me to recognize and to be aware of things which go on in me now and which I'm not aware of. But the aim is not historical research.
I see. And so you're not rigorously going to be concerned necessarily about the first 5 years of life or even any time sequence in the historical development of the individual?
I find, for instance, Adler's idea to ask the patient the first hour what are the most important memories he has of his childhood. I find a very good idea, because very often really very relevant material comes up this way. I'm convinced that a great deal happens in the first 5 years, which really are very important for the development of the person. But I think many other things happened, which happen later, which are equally important, which may change things. For Freud, really, the concept of a repetition compulsion, that the main things happen in the first 5 years, and then things are just repeated. That to me is too mechanistic a concept. I think nothing in life is repeated, only a mechanic thing can be repeated. And there are all sorts of things which happen which change things. Also, I would put, if I could say that in parentheses, a good deal of emphasis on the constitutional factor. Freud did that theoretically, he said so, but I think most analysts, and especially the public, thinks that what a person becomes is nothing but the result of what his parents did to him. And then we get to this kind of sob story, which you find so often in analysis: my father didn't love me, my mother didn't love me, my grandmother didn't love me, and so I must excuse me, I almost said something, I'm a nasty person. Well, that is very easy. So you give all the fault to the people around.
In other words, you have a way of rationalizing your behavior.
Exactly.
In fact, the theory contributes to it, in fact.
Exactly, and I think that's wrong. In the first place, there are a number of constitutional factors, and in the second place, and this is now a very important question for therapy, in my sense, the important thing is that the patient can mobilize his own sense of responsibility and activity. I think a good deal of what goes on under analysis today is based on an assumption which many patients have, that this is the method in which one gets happy by talking, without taking risks, without suffering, without being active, without making decisions. Now, this doesn't happen in life, and it doesn't happen in analysis. Nobody gets happy by talking, not even by talking in order to get interpretations.
Yes.
In order to change, the patient must have a tremendous will and impulse to change.
Yes. Incidentally, isn't it true that to some degree, perhaps even distorted Freudian theory and even some of the sociological theory has converged so much into the thinking of society that the people, even in everyday life, have gotten to the point where they no longer assume self-responsibility and they're ready to blame delinquents will blame the police or blame the parents,
exactly.
or the criminal will blame society.
Exactly. Everybody blames somebody and he evades responsibility. Now, if I say evades responsibility, I'm not talking from the standpoint of a judge. I do not accuse anyone. I do not think we have a right to accuse anyone as if we were the judges. But still, this is a fact. Nobody gets well unless he has an increasing sense of responsibility, of participation, and in fact a sense of pride in his achievement of getting well.
Now, therefore, going back to an earlier point that I raised, the dangers that we mentioned about transference are that the patient becomes too dependent, and what you're doing as a kind of a countermeasure is never allowing this dependence to emerge by maintaining that the patient must continue to muster any and all self-responsibility.
I will challenge the patient. For instance, the patient very often says, you know, I must change. I can't go on like this. Let us say a neurotic patient who has this or that problem. And I say to him, now look here, this is not at all true. You have lived 35 years with this pattern. You haven't died, and most people don't die from it. You will live another 30 years or 35 years very comfortably. You will have your problems. You will feel, you will have all sorts of sterile suffering, but you can go on. Don't kid yourself. And in fact, I would say, in some cases, if I look at the life pattern you have had so far, I think it's most likely that this analysis would not help you, because you are much too comfortable. You have shown you have all sorts of mechanisms by which you can cope with the situation. So I would say, statistically speaking, probably that 80% this will not help you. But maybe there are 20%, and that's good enough, provided you want. You have a very great impulse to change, and that we shall see in our work.
Yeah. Now, doesn't that automatically definitely limit the number of patients that will continue therapy with this type of orientation?
No, on the contrary, of course. If I say that, this very challenge will have the opposite effect. It will challenge the patient's sense of responsibility, and he will want to continue.
Yeah. Now, as I see what you're discussing then, you are shifting perhaps from Freudian therapy, the traditional Freudian therapy, in two ways. You are deliberately trying to maintain a feeling and empathy, assuming that you have some parts, quotes, of what the patient has, unquote. And secondly, you are not allowing dependence to be created. You're not allowing transference to lead to greater dependence. You're trying to maintain responsibility or feeling responsibility on the part of the patient, and you're suggesting that far from eliminating some patients, this will actually be a challenge to many, and nevertheless, however, you're realistic enough to recognize that perhaps therapy is not a cure-all, that not all people are going to respond to psychoanalytic therapy.
Well, and also as far as reducing dependence is concerned, that is a matter of in every case. If you have a patient who is a near schizophrenic with an extreme, what I would call symbiotic attachment to his analyst, which is...
By the way, by symbiotic here, let me, if I can just break in for a moment.
Yes,
to make sure you're meaning like the biological conception of symbiosis, where each organism, in a sense, gets something from the relationship.
Yes, and not only that, in which the person feels absolutely lost if he does not have that unshakable or unbreakable tie with the host person. You will find in many pre-schizophrenic patients or schizophrenic patients, that there is a symbiotic relationship to the father or mother figure, and that at the moment where they are confronted with the necessity to stand on their own feet, they might have a psychotic breakdown. In the symbiotic relationship, I would put it this way: the process of individuation has not occurred in spite of the fact that the person is beyond adolescence.
Well, now, Dr. Fromm, we've now had an opportunity to discuss some of the basic factors involved in your approach to psychotherapy, which, of course, are indeed, to me, very interesting, because I know that you have not actually published these as yet, and it was kind of intriguing to see how many of your theoretical notions came to bear on your psychotherapy. Now, of course, you have, however, written quite extensively about dreams, for example, in the forgotten language.
Yes.
And I think one of the things that might be a further opportunity, or allow a further opportunity to elaborate your psychotherapeutic approach, would be to see how the use of dreams in the therapeutic situation say, handled by yourself. Now, one, of course, very interesting distinction we see in some of the earlier theories of dream and dream interpretation are Freud's view that dreams are primarily, might say, characterizations and symbolic forms of the past and a latent form, whereas Jung, to a great degree, looked upon dreams as vehicles to look toward the future. They were really formulations of the future, and he used this type of technique. And of course, Jung also was less likely to be interested in only the latent content, but was also interested in the manifest content. Now, how do you feel about dream interpretation from these two perspectives? Do you think that it's either or can it be a combination of both?
Well, in the first place, I believe that dream interpretation is about the most important instrument we have in psychoanalytic therapy. There's nothing the patient can say. Association, slip of the tongue, and whatever it may be, which is as significant revealing as dreams. And I believe, as Freud said, that the dream interpretation is really the royal road to the understanding of the unconscious. Now, as to the second question of the difference between, or my view on the difference between Freud and Jung, I am indeed neither of the one or the other opinion. I think Freud, as you say, not only pointed out that the dream referred to the past, that is to say, really desires, instinctual desires which come up in the dream and which are rooted in the past, but Freud assumed also, as you indicated, that really the dream text is necessarily distorted, and that the real meaning of the dream, namely what Freud calls a latent dream, has to be snatched from the manifest dream text. And if you read Freud's dream interpretation, there is something very strange going on. If you read in his Book of Dreams, many of the dreams he presents. Namely, this is a tremendous intellectual exercise. You get this association, that association, and yet I have the feeling that after you are all through with it, you don't know so much more about the patient, about what goes on unconsciously as you knew before. Now, on the other hand, Jung said the dream is an open message and is not distorted. Now, I don't think that is true, and I think many of the dreams which Jung interpreted, he misinterpreted, because they are not that open. I have in the book which you referred to, in the first place, made one distinction between two kinds of symbols, namely the accidental symbol and the universal symbol. If I dream, for instance, about a city, about a house, about some particular time, then I deal with an accidental symbol, and only by the association of the patient can I really know what this means. Otherwise, I couldn't know it. But if you take, for instance, the following dream, the person dreams that he's first in a big closed building, then with a girl, but he's afraid that people will recognize him. Then he finds himself with a girl on a beach, walking on the ocean, but it is night. And in the third part of the dream, he's all by himself. Right of him are ruins, and to the left of him are cliffs. Now there you do not need associations necessarily, because this dream deals in universal symbols. And what we find in this dream is a regression in depth. Consciously, his level is he's with a girl. In fact, this patient is married. He is in a big building. However, that is a mother symbol, but still he's with a girl, but he's frightened. Then he is still with a girl, but it is night. And eventually he's all alone, and he's only with a mutilated mother, namely the cut off cliffs and ruins. Now, here you see in this dream the central problem of this patient formulated, without the necessity of understanding, of even having associations. Now, I ask every patient for associations because sometimes, even in this case, the associations help. And I find many dreams where something essential is repressed. Jung gave a very good example of this in one dream he reports in his posthumously published autobiography. He dreamt that he felt he had to kill Siegfried. So he goes out and kills him. Then he feels very guilty, and he is afraid that he would be detected. Then, to his great satisfaction, comes a heavy rain, which washes off all traces of the crime. He wakes up with a feeling, I have to find out what this dream means, otherwise I have to kill myself. Then he thinks about it and he finds out that the dream means that in killing Siegfried, he kills the hero in himself, and that the dream is a symbol of his own humility. Now, this dream was indeed distorted because the name Sigmund Freud was changed into Siegfried. That was all the distortion there was. And that was enough for Jung not to see that in this dream he was doing precisely what Freud had always told him he wanted, namely to kill him. And he wasn't even aware of the meaning by something so simple, namely the feeling that if he did not understand the dream right, he would have to kill himself. What it really means, of course, is if he did not misunderstand the dream right, namely his wish to kill Freud, he would kill himself. He would have to kill himself. So he found an understanding which is the opposite of what the dream really means. Now here you see how there is distortion, how there is complete repression, and then a rationalizing interpretation of the dream. And that doesn't happen so rarely. That's why the Jungian version that the dream text is always the manifest text is always identical with what Freud calls a latent content is simply not true.
Yeah. Now, of course, there's another side in Jung's theory and his interpretation of dreams that he might have brought it to bear on this dream that you gave us. And, of course, he developed, and really, I suspect, developed much further than Freud did, this conception of archetypes. Of course, in some of Freud's early work, he talked about archetypes like the archetype that led to feelings of castration anxiety, and of course Jung developed an infinite number of archetypes, and of course this has been a very controversial concept. It's almost a quasi-Lamarckian idea that you can inherit, inherit these things. Yet, in a way, there might be a possibility that your conception of universal symbols might appear to be the same thing that Jung is talking about when he talks about archetypes.
Well, you're perfectly right. In many ways, what I call universal symbols are Jung's archetypes. It's always a little difficult to talk about Jung theoretically because he has been so, has expressed himself in a very brilliant, but very often in a very obtuse or not quite clear fashion. So it's awfully difficult to say what exactly he meant by any of his concepts. But nevertheless, I think the concept of the archetype is a very fruitful concept, or at least what it refers to. I would say one might also stress from a humanistic standpoint that since man is always the same in his very basic condition of existence, namely in being split between awareness and being determined as an animal, and yet having self-awareness. Therefore, man has only a few solutions, a few answers to give to the question which life poses to him. These answers can be regression to mother's womb. It can be the answer of finding safety in obedience to father. It can be the answer, which has been the answer of the great religion and the humanist philosophies, namely of finding new harmony with the world by developing all his human powers, especially reason and love. In other words, the number of answers which man can give to the question of life are limited. He has to choose between them, and the number of symbols which represent these answers are also limited. They are universal because there is only one man.
So, in other words, Jung's concept of archetypes, which talked about such things as the father and the hero and so on and so forth, looking at the whole history of man's existence and saying that instead of being infinitely structured, there's a finite structure. There's only a limited number of possible responses in his repertoire, that this will condition the possibility that there could be, therefore, universal symbols and dreams.
Exactly. There are a few choices man can make. Let us say the concept of the symbol of the hero is a man who dares to risk individuation, or as the Old Testament says, Abraham is a hero, because Abraham is told by God, leave thy country and leave thy father's house and go to a country which I shall show you. This is always a symbol of the hero, who dares to risk his whole existence by independence, and who is daring in this sense, who leaves certainty and risks uncertainty. Well, that is in fact part of the fate of man, and that is one of the possibilities for man. The other possibility is precisely not to dare to risk individuation and to get stuck in mother, home, blood, soil, and never reach individuation and never become an independent person.
Yes. Now, could you perhaps specify from maybe an actual therapeutic session without, really in any way embarrassing the patient, a way that a dream had been used, or how a patient had come to you with a dream and how you proceeded to work with the patient with that particular dream? Yes.
Well, that depends. If the patient will tell me this dream in the second hour, I will probably not say much, because I will assume that if I would give him the interpretation, he would not understand it, except some people, even if they are not near psychosis, are very sensitive. They are people who like poetry, who would understand this interpretation, because they are not bound so much to words and to concrete things. I might, however, even in the second hour, say to this patient, you seem to be afraid of being cut off from life and being stuck with something which is dead, ruinous, which has no life, because that's precisely what the patient is. In other words, how I use the dream would depend on what I think the patient could understand at the moment. I'm not so terribly cautious, except in some patients, that the patient may not understand it. Many students in seminars say when they present a case and I suggest to tell something to the patient, they say, well, but I'm afraid the patient cannot take it. Mm-hmm. And my first response usually is, the only one who cannot take it is you. Mm-hmm. Because you are afraid of sticking your neck out, yeah, to telling something to the patient, to which the patient might react with anger, with disturbance, and you're not sufficiently sure that you are not right. It's not precisely the matter of being right necessarily, but you're not sufficiently sure of your own interpretation. It takes a good deal of experience and sensitivity and of what you call empathy to really sense the meaning of the dream.
Now, about everything you're saying so far seems to point to tremendous need for experience on the part of the therapist. This corresponds in a very interesting way to a research study that I'm sure you're aware of that many years ago Dr. Fiedler, at that time at the University of Chicago, completed, in which he did tape recordings of experienced Adlerian therapists and their students in training, yes, experienced psychoanalytic therapists and their students and so on, Rogerian students and found that just hearing the therapeutic sessions without knowing what orientation, that regardless of what the orientation was, the experienced men sounded quite a bit alike, and the inexperienced men sounded alike. In other words, yes, it wasn't very apparent what system they were supporting.
I'm sure that's true. What matters first is that an analyst makes sense, and he may make sense in any frame of reference. I think some are better than others, but really, I would say the primary thing is his experience and his understanding of another human being. See, there is one very important thing, and that is the problem of the analyst. I would say many analysts become analysts because they feel very inhibited to reach human beings, to relate to human beings. And in the role of an analyst, they feel protected, especially if they sit behind the couch, but it's not only that. Now, what is very important is that the analyst is not afraid of his own unconscious. I said that before, and therefore, he's not afraid to open up the patient's unconscious, and he's not embarrassed about it.
Yes. Now, within the framework of your therapy, I would be rather interested in knowing how a major conceptualization, for example, of the sort that you include in The Art of Loving, one of your fairly recent books, comes to bear on the therapeutic relationship. For example, you make, to me, a very intriguing distinction that has, I think, a lot of significance today when we're very interested in the self and the ego and its development. You make a distinction between love of self and self-love. This seems to be one of the very interesting distinctions in this entire book. How is that brought into the therapeutic situation? How does that bear on the way a patient develops in therapy?
Well, what we call selfishness, egotism, and self-love in one sense is really one form of greediness. And that greediness I try to analyze. I try to bring to the patient's awareness the greediness in him, whether it's greediness for food, or greediness for affection, or greediness for possession, or greediness for fame, or greediness for comfort. Greediness in itself is one of the most fundamental human vices, most of us have that vice. It was the great idea of Buddhism as well as of Christianity to say man must overcome his greediness in order to be free. Now, love in the sense of self-love, in which I have used it in the art of loving, in fact, in this sense, it has been used by, let us say, by a great man like Master Eckhart, is something quite different. It is a loving, friendly, affirmative attitude towards oneself, and I've tried to say a person who has that attitude towards oneself has it also toward others. It's something indivisible. It is the contrast of a necrophilic, destructive attitude, which also is not divided really between having it toward others and oneself. It is an orientation. If I love death, if I love the inanimate, if I love the mechanical, then indeed it is a matter of very secondary conditions, whether that's primarily directed toward others or toward oneself. In fact, usually it's toward both, sometimes more conscious this way, sometimes more conscious the other way.
Going back for a moment to our earlier distinction between productive and non-productive orientations, would it be correct in assuming that, as you see it, the truly productive individual then is capable of a true, genuine love of self, and the non-productive, it's his greediness, his self-love? Is this
yes.
a very important distinguishing
Indeed,
characteristics?
indeed. I would say one of the elements of productive orientation is the capacity of a person to love others and himself. It is secondly the capacity of to use his reason. And if I could, since you mentioned this question now, add something. Sartre has put a great deal of emphasis on this particular concept, and I think there he has said something quite important, namely authenticity of the experience as against the lack of authenticity. Mm-hmm. And I think actually people today, and what especially the analyst today ought to learn, first of all, is to see the distinction between authenticity and facade. And actually that sense is greatly weakened today. Most people take words for reality. Now that's already a crazy, insane confusion. But I think also most people do not see the difference between facade and the authentic, although unconsciously they do. I think you can find not so rarely a dream in which a person has seen a man in the daytime and he thought he was very nice and he liked him, and then he has a dream in which he sees this person as a murderer or as a thief, which simply meant subliminally he was aware that this man is dishonest, but in his consciousness he was not aware while he saw him. And why not? Perhaps, well, you don't assume somebody's a murderer. I don't mean realistically murderer, but in his intentions, if somebody is destructive unless you have proof, or maybe the man said something nice to him and so he was flattered. In our dreams we are usually honest, much more honest than we are in the daytime, because we are not influenced by events from the outside.
Yes. Now, we have now looked at the therapeutic process as you see it and some of the factors operating. We looked at dream interpretation, we looked at the process of how you view love as in the sense of some of the conceptualization of the art of loving. Now, let me just get a little bit more concrete for a moment. How do you feel about the use of tranquilizers in therapy or as adjunct to the therapeutic process?
But of course you are now talking about tranquilizers and not about the psychodrugs which are used for the cure of depression. And actually, if you have a patient with a severe depression, danger of suicide, and by drugs, this depression can disappear, although many of the character problems might remain, then I personally believe it would be cruel and not to relieve the patient from his suffering, because you have pretty good evidence that in many cases this drug will really get him out of the acute depression. You have not that good evidence that analysis will get him out of it. And I think if then you connect the psychotherapy and psychoanalysis with, if you combine it with the giving of such drugs, then indeed you have very often a very good chance to not only remove the symptom of depression, but also to change something in the patient.
Now, another problem I think that has to be, I think it's a challenge to the individual doing individual therapy, is the tremendous growth of group therapy. Group psychotherapy is growing by leaps and bounds, as you know, all over the world.
Yes.
And, of course, those advocates of group therapy, as you well know, say that the individual therapeutic situation is kind of artificial, that you're creating an artificial environment for the patient, you're teaching them to become adjusted to it, and this doesn't make sense when so many of the person's personal problems come from society at large. So keep therapy as close to the social order as possible, therefore group therapy. I wonder how you feel about that.
Well, you know, I'm very suspicious of it, but I have to say it also. I have never done group therapy, and probably precisely because I dislike it tremendously. I just dislike the idea of one person talking intimately about himself in front of 10 other people. I couldn't stand it. I also have the suspicion that this is the psychoanalysis for the men who cannot pay $25. But if 10 get together, they pay 50, and that's fine. But actually, I would say, I can imagine that, especially for adolescents, group therapy might be very useful. If they are not very sick, they have similar problems, it might help them to see that they have common problems, and on a superficial basis, with some good teaching, some good advice, I think their problems might be alleviated. It's a very good thing. But I do not think it's in any way a substitute for psychoanalysis, because that is a problem which is that individualized and that personal that I don't think it lends itself to the method of group therapy. And I am an individualist. I'm an old-fashioned man. That's why I believe that the method or the system, the atmosphere which we're having today, in which privacy becomes more and more reduced for the sake of common chatter and a lack of privacy, to me this is an anti-human and anti-humanist attitude, and I don't think it's conducive to any good therapy, except in very specific cases where I do not want more. And all this thing that is artificial, that doesn't impress me at all. So a love relationship between two people is also artificial, because they don't make love in society, and their most intimate hours, I don't mean only sexually, are not shared by 10 other people. I think there's a lot of rationalization of an age in which privacy gets lost more and more. If I may make this remark, I'm concerned with freedom, but I'm equally concerned just with privacy.
Well, those that are involved in this group psychotherapy movement would probably, interestingly enough, be rather surprised at your reaction here, because so much of your work is steeped in sociology and social psychology. And in fact, if I recall correctly, I think that some of the people in group psychotherapy have been rather influenced by some of your concepts. I think that, of course, like everything else, we have so many different approaches to these problems, and I suspect that you would agree that we should leave the door open to these various approaches and not necessarily settle on one as being the final answer.
No, in fact, I don't believe psychoanalysis is the final answer. And I think group therapy can do many things. All I really meant to say was group therapy is not a substitute. It cannot achieve what individual psychoanalysis can. It's a different thing.
Now, I'd like to ask you a question now that I think a lot of us who've been reading your work over the years are very, very interested in. We see a man in you that has dared, in a sense, to move out of what we sometimes call, quote, scientism in a rather narrow sense, that you've become interested in religion, you've become interested in philosophy, you've been interested in sociology, and in a very broad sense, in a very abstract sense at times, as you formulated your systems. Now, where do you go from here? You pursued these things diligently with a great deal of imagination. What kinds of things do you see for your interest in the future, the things you'll be writing about, the things you'll be doing?
I'm almost 64, so I have to think of my future in terms of not so many. And I can tell you what I'm interested in. I just finished a book on the roots of evil in man, in which I try to discuss concepts like necrophilia, like symbiotic incestuousness, or and narcissism in its destructive aspects. Then, when I'm through with that, I shall write a book on humanism in modern times, which is essentially a question of what is the humanist movement today. I don't mean the official humanist movement, but I see a great deal in figures, let us say, like Einstein, Schweitzer, Russell. I see a representative of the, or theologians, or let us say the late Pope John, or theologians like Rana in the Catholic Church. I see a renaissance of humanism, and I'm going to write about that, and then I shall write a book on the Old Testament, which I wanted to write for 20 years, never had time.
Yes.
And then I want to write 2 or 3 volumes of a systematic exposition of humanistic psychoanalysis, both theoretically and technically and clinically. Well, if I can do all this, this covers quite a few years.
Well, I would guess,
one has to be optimistic.
Observing your enthusiasm here, Dr. Fromm, and our discussion, I will predict that there will not only be these, but many, many more to come.
Well,
I want to thank you very much, because this is asking quite a bit of you to spend your time this way, and you've been not only cooperative, but I would say you've just gone out of your way in every possible way to help us, and we really appreciate it very, very much.
Thank you very much. It gave me great pleasure, so there's nothing to thank me for.